is incumbent upon all of us to recognize what is self-evident, and that is that it is our decisions, not our conditions, our decisions that will determine our fate and future as it relates to the spread of this virus. It's our decisions that will determine how quickly our children go back to school. It is our decisions that will determine what kind of activities we get to once again enjoy with our friends and family. And of course, it's our decisions, personal and sum total of all of our decisions, that will determine how quickly our business sector can reopen with some semblance of the way things used to be. It's important to remind all of us that this transmission can be substantially mitigated by wearing face coverings, by wearing face masks. This slide we present is pretty self-evident, and I think the evidence is overwhelming. We've seen in other countries as it relates to the importance and potency of wearing face coverings to mitigate the spread of this disease. Recommendations now from the CDC clarifying that point of view, and clearly now an increasing number of people that are taking the personal responsibility not only protect themselves, but to protect others. And I just want to thank all of you that are doing that, for practicing the kind of behavior that will allow us to move past this pandemic sooner than we otherwise would. The issue of going outdoors and taking activities specifically that traditionally have been indoors and now moving them outdoors, obviously also to the extent airflow is a big part of that, can mitigate the spread of the virus as well. And that's why we talk often, not just about masks, but the importance of moving indoor activities outdoors. Accordingly, we talk about physical distancing, social distancing. Some refer to it physical distancing, just being 6 feet apart from people you otherwise do not mix with, people that are outside of your household, people that you come close contact with when you're out doing the essential day-to-day work that we all need to do. Fewer people you mix with, the significant reduction in the likelihood of seeing others contract the disease, and of course you as well being impacted by this disease. This next slide bears, I think, some consideration and reflection. I put this slide up a few months ago. It's worth putting back up today. The power of exponentials, this notion that just an individual that is positive, that comes into contact over a 5-day period with just 2.5 people. Within 30 days, those 2.5 people start mixing with others, and now you have over 400 people that have come down positive with COVID-19. You see just a significant, or rather modest by some people's estimates, but significant in terms of its impact, reduction in the number of people you've been exposed to. You just cut that in half from 2.5 people to 1.5 people. Now you're only impacting over a 30-day period through the power of those contacts, 15 people, and less still if you reduce your exposure to less than one individual. And so the point is, we have to minimize our mixing. We have to minimize the transmission of this disease. We have to minimize that by practicing physical distancing, wearing the face coverings, and doing the kinds of things that I think are well described and obviously now need to be more vigilantly followed if we're going to move past this more expeditiously. Last week, on Monday, I put out this new dimmer actions that we're taking in the state of California and what we've done statewide. We talked about those counties that are on the monitoring list, 33 counties, and I'll give you an update on those county lists here in a moment. Again, focusing on indoor operations, on gyms and fitness centers, places of worship, still allowing activity to occur outdoors. Accordingly, issues of barber shops and personal care services. I want to just make personal clarification on the issue of personal services. This was the slide we put up a week ago relating to indoor activity. It was our intention to provide for barbershops and the likes to be able to do their work outdoors. Turned out that was more challenging than it may have appeared. The good news is we now have new guidelines out on the COVID-19.ca.gov website, COVID-19.ca.gov cdc.gov website clarifying what we can and can't do as it relates to haircuts and activities that we want to move indoors, outdoors for personal care service industry. It turns out, without getting into too many details, but issues of chemicals and shampoos and perms, it was more complicated than some had considered, particularly as it relates to local ordinances and rules and regulations that were in place. So we worked through that over the last number of days, and those new guidelines are up, and hopefully that provides some more clarity. If we need to provide even more, we'll get the good feedback, which I anticipate from the new guidelines we put up. But rest assured, the intention was to provide those activities with conditions outdoors, no longer indoors. Here's why. Again, we're seeing an increase in our 7-day average, total number of COVID-19 positive cases yesterday, July 19th, 6,846 positive cases. 7-day average, you see up there, 8,911. We take a closer look at our positivity rates, number of people tested, number of people that test positive, becomes a positivity rate. With now record 7-day average of daily tests, over 124,000 daily tests on average over 7 days. By the way, 127,000 tests yesterday. Our positivity rate over a 14-day period is holding at 7.4%. This time last week, it was at 7.4%.
Hello, I'm Mark Brown. Click the ABC7 logo to subscribe to our Eyewitness News YouTube channel.